Hello my friends, my name is Dr. Said Kazmi. You're watching my YouTube channel, and today we'll be talking about interpretation of the thyroid function test. So let's begin with the question. When you get your thyroid function test back, what is the very first thing you look at? And that's right, that is thyroid stimulating hormone. Now TSH is the most sensitive marker because the pituitary gland detects even tiny changes in your circulating thyroid hormones. So the practical approach is always start with TSH, and after that you look at the free T4, and if needed you also look at free T3. So today we will structure our entire presentation around this simple but powerful first step, and that is TSH always first. Now let's say you find out TSH is low. So you imagine you have a patient whose TSH level is low as compared to the normal values. Now here the pituitary is essentially saying that there is too much of thyroid hormone around, so let's shut down the production. But the question is there really too much of the thyroid hormone? So we check free T4 to find out answer to this question. So let's go through what we might see. So we might see that the TSH is low and the free T4 is high. So if the free T4 is genuinely high, that confirms the pituitary's suspicion. That is what we call as classic thyrotoxicosis, like Graves' disease, toxic multinodular goiter, or thyroiditis in the hyperthyroid phase of the illness. Now the lab and the patient physiology are both telling the same story, and that is too much of the circulating hormone. Let's say you find out that the TSH is low but the free T4 is normal. If that is the case, you always check for free T3. So remember, if free T4 turns out to be normal with a low TSH, don't stop there. Just order for a free T3 and look at its level. If free T3 is high, that's T3 thyrotoxicosis, often early Graves or nodular disease, which is secreting mainly T3. But if both free T4 and free T3 are normal, then think about non-thyroidal causes, like for example recent high use of dose steroid use of dopamine, or any severe illness. They can all suppress TSH without through thyrotoxicosis. So keep those things in mind. The third possibility is that the TSH is low and the free T4 is also low. So if both TSH and free T4 are low, that suggests that the pituitary itself isn't doing its job. We call it secondary hypothyroidism due to pituitary or hypothalamic disease. So remember, if both are low, that is TSH and T4, there is always a central cause. So clinically always look for other pituitary hormone deficiencies too. So the problem is somewhere in the brain, in the pituitary gland, or in the hypothalamus. Moving on to the next slide. Let's say if the TSH levels are high on your thyroid function test, when you're reading that, the TSH is high. So if it is high, the pituitary is shouting that it's trying to wake up a failing thyroid gland. So now we have to look at the free T4 levels. So let's say the TSH is high, but the free T4 is low. Now that is the most common pattern. We call it primary hypothyroidism. It's usually caused by autoimmune thyroiditis because the thyroid gland cannot produce enough hormone, so the pituitary ramps up the TSH in response. So it's trying to gear up the TSH so that the thyroid can produce more T4. The other scenario is that the TSH is high and the T4 is normal. So if the free T4 is normal along with the high TSH, this is what we call as subclinical hypothyroidism. It's an early stage where the thyroid is beginning to fail. It's just the early stages of the illness, but the hormone levels are maintained for normal level, at least for now. So you can also sometimes consider poor compliance with thyroxine tablets, especially in those patients who are taking thyroxine for hypothyroidism, and these patients probably are skipping doses. They may have high TSH, but because they are taking occasional doses, their free T4 is still in the normal range. Then if the TSH is high and the T4 is also high, this is a rare condition, but it usually means that the pituitary is a problem. It's a TSH secreting adenoma either in the pituitary or somewhere in the brain. The clue is that the patient often looks hyperthyroid clinically, even though the TSH is inappropriately high. So the problem is central. It's usually a TSH secreting adenoma or tumor of the pituitary gland. The third scenario is that the TSH is normal. It's neither high nor low, but it is normal. So Most of the time, this simply means that there is a normal thyroid function, but there are certain exceptions because you again have to look at the T4. So if the TSH is normal, but the free T4 is high, this can happen in very early hyperthyroidism before the TSH has time to fall, or in certain cases of thyroid hormone resistance, which is a rare condition where the tissues don't respond normally to thyroid hormone. The second scenario is that the TSH is normal and the T4, the free T4 is low, it's low. So this might indicate early central hypothyroidism before TSH drops significantly. Or sometimes it can also occur in what we call a sick euthyroid syndrome in critically ill patients. In these patients, they've got illness and the thyroid actually is suppressed because of that illness. The third possibility is where you get a normal TSH and a normal free T4, and this is of course a true euthyroid state or normal state in which the thyroid and the pituitary both glands are doing their job very properly. A little bit I want to touch on the sick euthyroid syndrome, because let's highlight like this condition separately, because it can confuse even very experienced clinicians. In severe illness, the free T3 drops first. Sometimes the free T4 also drops, but remember the free T3 drops as the first thing. The TSH can be low, normal, or even sometimes slightly high. So the key message in sick euthyroid syndrome in critically ill patients is that don't treat the labs, actually treat the patient and repeat the thyroid test after the patient has recovered from that illness. So you might ask me how to remember all these things. So to help lock this in, there is a simple pattern table which you can see here on the screen. So remember, if you look at this table, always start with TSH to see if the TSH low, high or normal. And depending on the TSH levels, then you look for what is the free T4 telling you, whether the T4 is high, whether it's normal or whether it's low. So always go in a methodical form. Always start with TSH followed by free T4 levels, and if needed a free T3 as well. So you can notice on this table that how each combination points towards a distinct clinical scenario. So you can print this table out, keep it in your phone, or just remember this formula, that TSH first and T4 next. So one quick clinical tip here is that when do you bother checking free T3 levels? Somebody might ask you in exam, or this question might be there in your mind. Now, mainly you check free T3 when the TSH is low but free T4 is normal. So when the TSH is low but free T4 is normal, in that particular case you will look at free T3, because there can be a condition called as T3 thyrotoxicosis. But also be careful interpreting be careful interpreting low T3 in critically ill patients, just because it can be a part of sick euthyroid syndrome, and in that particular case it does not need treatment. You just need to treat the underlying condition. Some of the drugs can also have their side effects, so never forget the drugs. Steroids and dopamine, remember, steroids and dopamine can suppress TSH levels. On the other hand, certain medications like amiodarone can cause either hypo or hyperthyroidism, both like hypo or hyperthyroidism, and that it can make that interpretation very messy. So always ask about medications when you are looking at the thyroid function test. So I would simply say that ask the patient about medications when the thyroid results, they look very strange. So the way to practice all this is to look at certain cases. So look at case number 1. If the TSH is low and T4 is high, then what do you think? Yes, you're right, it's thyrotoxicosis. Case number 2, if the TSH is low and you look at T4, that is also low, so that is what we call a secondary hypothyroidism. Let's say the TSH is high and the T4 is low. Well, that is primary hypothyroidism. And if TSH is high but T4 is normal, as I told you earlier, that is subclinical hypothyroidism. So again, the key is the same thing. Always TSH first, and then you look at the free T4 levels. So to sum it up, remember, always start with the TSH levels. If the TSH is low, again you check free T4, whether it's high, normal or low. If the TSH is high, again you look whether the free T4 is high, normal or low. If the TSH is normal, again you would look at the free T4, whether it's high, normal or low. And remember drugs. Remember sick Euthyroid syndrome, and remember compliance with medication if somebody is already on thyroxine tablets. So labs are just numbers, but clinical reasoning turns them into a true diagnosis. So just don't read thyroid numbers, read the story behind it, and you'll never look at thyroid function test the same way again. So I hope this lecture gives you an insight into how to look at or how to interpret the thyroid function test, and makes your clinical interpretation or lab interpretation of the thyroid function test very easy. If you've liked this video, share it with your friends. If you haven't subscribed to my channel, subscribe. And if you've got any question, put it down in the comment section below, and I will be more than happy to answer them. Have a very good day. Take care, and bye-bye.